Acute bronchitis is a respiratory condition or disease. Look at this picture, shows that lungs, bronchial tubes affected by chest X-ray findings and CT findings. Detail going on. Introduction. Acute bronchitis is a common respiratory condition characterized by inflammation of the bronchial tubes, which carry air to the lungs. This inflammation leads to increased mucus production and other symptoms that affect breathing. Definition. Acute bronchitis is defined as the sudden onset of inflammation in the bronchial tubes, typically lasting less than 3 weeks. It is often caused by viral infections, but can also result from bacterial infections or exposure to irritants. Types. 1. Viral bronchitis. The most common type often following a cold or other upper respiratory infection. 2. Bacterial bronchitis. Less common, caused by bacterial infections. 3. Irritant induced bronchitis, caused by exposure to irritants like smoke, dust, fumes, and pollution. Causes. 1. Viral infections. Most common caused by virus such as the influenza virus, rhinovirus, respiratory syncytial virus, RSV, and adenovirus. 2. Bacterial infections, less common, caused by bacteria such as mycoplasma, pneumonia, chlamydia pneumonia, and Bordetella petrosis. 3. Environmental irritants, exposure to tobacco smoke, air pollution, dust, and chemical fumes. 4. Other factors. Gastroesophageal reflux disease, GERD, can also contribute to bronchitis. Risk factors. 1. Smoking, increased susceptibility to bronchitis. 2. Environmental factors, exposure to pollutants, chemicals, and dust. 3. Age, older adults and young children are more susceptible. 4. Weakened immune system. Conditions like HIV/AIDS and chemotherapy can increase the risk. 5. Pre-existing lung conditions, asthma, chronic obstructive pulmonary disease, COPD, etc. Complications. 2. Pneumonia, secondary bacterial infections can lead to pneumonia. 2. Chronic bronchitis. Recurrent episodes can lead to chronic bronchitis. 3. Exacerbation of asthma or COPD. Acute bronchitis can cause these conditions. 4. Bronchiolitis, obliterans, rare but severe inflammation causing airway obstruction. Pathophysiology. 1. Initial infections. Virus or bacteria infect the bronchial mucosa. 2. Inflammatory response. Body immunoresponse causes inflammation and edema. 3. Mucus production. Coagulate cells produce excess mucus. 4. Impaired cellular function, cilia, which help clear mucus, become damaged. 5. Airway obstruction, excess mucus and swollen airways cause obstruction and coughing. Signs and symptoms. 1. Cough, often productive with mucus. 2. Sputum production, clear, white, yellow or green mucus. 3. Fatigue, general tiredness and weakness. 4. Shortness of breath, especially during exhaustion. 5. Chest discomfort, pain, tightness. 6. Wheezing, high-pitched whistling sound during breathing. 7. Fever and chills, less common, usually with bacterial infections. Diagnosis. 1. Clinical history and physical examinations. Primary methods for diagnosis. 2. Chest X-ray to rule out pneumonia. 3. Sputum culture to identify bacterial causes. 4. Pulmonary function test in chronic or severe cases. 5. Blood test to check for infections or other causes. Nursing diagnosis. 1. Ineffective airway clearance related to increased mucus production. 2. Impaired gas exchange due to inflammation and mucus obstruction. 3. Fatigue related to persistent coughing and infection. 4. Activity intolerance due to shortness of breath and fatigue. Management. 1. Rest and hydration to support recovery. 2. Humidified air helps loosen mucus. 3. Cough suppressants for dry cough. 4. Expectorants to help clear mucus. 5. Analgesics and antibiotics for pain and fever relief. Six. bronchodilators for wheezing and shortness of breath. 7. Antibiotics only if bacterial infection is confirmed. Treatment. 1. Medications as maintained above. 2. Inhalation therapy. Nebulizers with saline or bronchodilators. 3. Oxygen therapy in severe cases. 4. Physical therapy. Breathing exercise to improve lung function. Psychosocial medicine. 1. Patient education about the illness, treatment and prevention. 2. Support systems. Encourage social support from family and friends. 3. Stress management. Techniques to reduce stress and improve immune function. 4. Counseling for patients with recurrent bronchitis or chronic conditions. Prevention. 1. Vaccination. Annual flu vaccine and pneumococcal vaccine. To avoid smoking and exposure to second-hand smoke. 3. Hand hygiene to reduce risk of infection. 4. Use of mask in polluted or high-risk areas. 5. Healthy lifestyle. Balanced diet, regular exercise, adequate sleep. In conclusion, acute bronchitis is a common and usually self-limiting condition that primarily affects the respiratory system. Understanding the causes, risk factors, and appropriate management and strategies is crucial for effective treatment and prevention. Nurses play a vital role in patient education, support, and care during recovery. By following preventive measures and timely treatment, the complications associated with acute bronchitis can be minimized. Thank you. Have a wonderful day.